Capsular contracture is when the capsule surrounding an implant becomes tightened and thickened and can constrict one or both breasts. Risk factors for capsular contracture are periareolar incisions, as well as smooth implants placed underneath the gland or in the prepectoral space. And a lot of patients come to me and ask, well, what can be done about this? And really, I think the first thing is, well, does this bother you? And if it does, I think that removal of the capsule as well as the implant, and by removal of the capsule, I mean the outer portion of the capsule. So we think of the capsule as two pieces, the one that's in the front and the one that's behind the implant. And we can discuss exactly what bothers you. What can be done about capsular contracture? Well, this is a surgical problem. And oftentimes I recommend going in through your prior incision and removing the capsule. And this is done as safely as we can do. This entails removing the capsule that's in front of the implant as well as the implant, and then safely removing what we need to in the capsule that's behind the implant. Now, the capsule that's behind the implant sits directly on your chest wall, which right below that are your ribs and your lungs. And so what we remove must be done safely. So I remove the capsule both in front of the implant and then what can be safely removed behind the implant. Oftentimes we have to leave a little bit of the capsule behind the implant if that's not safe to be removed, but I make sure to score it and to remove any of the outer layer of cells, and so that none of those diseased cells are left behind.